Today we are going to talk about Seroquel medication with the generic name Quetiapine. In this review we will explain its dosage, its side effects and what it is used for. Generic name and dosage of Seroquel. Seroquel 25 mg contains 25 mg of quetiapine, like quetiapine fumarate. Seroquel 100 mg contains 100 mg of quetiapine, like quetiapine fumarate. Seroquel 200 mg contains 200 mg of quetiapine, like quetiapine fumarate. Seroquel 300 mg contains 300 mg of quetiapine, like quetiapine fumarate. What is Seroquel used for? Seroquel is used for the treatment of schizophrenia, the treatment of bipolar disorder, for the treatment of moderate to severe manic episodes in bipolar disorder, for treatment of major depressive episodes in bipolar disorder, for prevention of recurrence of manic or depressive episodes in patients with bipolar disorder who have previously responded to quetiapine treatment. Dosage and form of administration. There are different dosage regimens for each indication. Therefore, it should be ensured that patients receive clear information on the appropriate dosage for their disease. Seroquel can be administered with or without food. In adults. For the treatment of schizophrenia. For the treatment of schizophrenia, Seroquel should be administered twice daily. The total daily dose for the first 4 days of treatment is 50 mg, day 1, 100 mg, day 2, 200 mg, day 3, and 300 mg, day 4. From the 4th day, the dose will be adjusted to the usual effective dose of 300 to 450 mg/day. Depending on the clinical response and tolerability of each patient, the dose may be adjusted within the range of 150 to 750 mg/day. For the treatment of moderate to severe manic episodes in bipolar disorder. For treatment of manic episodes associated with bipolar disorder, Seroquel should be given twice daily. The total daily dose for the first 4 days of treatment is 100 mg, day 1, 200 mg, day 2, 300 mg, day 3, and 400 mg, day 4. Subsequent dosage adjustments up to 800 mg/day on day 6 should be made in increments of no more than 200 mg/day. The dose may be adjusted depending on the clinical response and tolerability of each patient within the range of 200 to 800 mg/day. The usual effective dose is in the range of 400 to 800 mg/day. For treatment of major depressive episodes in bipolar disorder. Seroquel should be given once a day at bedtime. The total daily dose for the first 4 days of treatment is 50 mg, day 1, 100 mg, day 2, 200 mg, day 3, and 300 mg, day 4. The recommended daily dose is 300 mg. In clinical trials, no additional benefit was seen in the 600 mg group compared to the 300 mg group. See section 5.1. Some patients may benefit from a 600 mg dose. Doses above 300 mg should be initiated by physicians experienced in treating bipolar disorder. In some patients, in case of tolerance problems, clinical trials have indicated that a dose reduction to a minimum of 200 mg may be considered. For prevention of recurrence in bipolar disorder. For prevention of recurrence of manic, mixed, or depressive episodes in bipolar disorder, patients who have responded to quetiapine in the acute treatment of bipolar disorder should continue treatment at the same dose. The dose may be adjusted depending on each patient's clinical response and tolerability, within the range of 300 to 800 mg/day given twice daily. It is important that the lowest effective dose is used for maintenance treatment. Elderly patients. As with other antipsychotics, Seroquel should be used with caution in elderly patients, especially during the initial treatment period. The speed of dose adjustment may need to be slower and the daily therapeutic dose lower than that used in younger patients, depending on the clinical response and tolerability of each patient. The mean plasma clearance of quetiapine was reduced by 30% to 50% in older subjects compared to younger patients. Efficacy and safety in patients over 65 years of age with depressive episodes in the setting of bipolar disorder have not been evaluated. Pediatric population. Seroquel should not be used in children and adolescents under 18 years of age, due to the lack of data supporting its use in this age group. Kidney failure. No dosage adjustment is required in patients with kidney failure, liver failure. Quetiapine is extensively metabolized by the liver, therefore, Seroquel should be used with caution in patients with known liver failure, especially during the initial period of treatment. Patients with known liver failure should start treatment with 25 mg/day. The dose should be increased daily in increments of 25 to 50 mg/day to an effective dose, depending on the clinical response and tolerability of each patient. Side effects or adverse reactions of Seroquel. The most frequently reported adverse drug reactions, ADRs, with quetiapine are drowsiness, dizziness, dry mouth, headache, withdrawal symptoms, discontinuation, elevated serum triglyceride levels, elevated total cholesterol, predominantly LDL cholesterol, decreased HDL cholesterol, weight gain, decreased hemoglobin, and extrapyramidal symptoms.